If you or a loved one has been diagnosed with colon cancer, you know that news can be scary and the next steps unclear. At University of Maryland St. Joseph Medical Center, patients are put at ease and their course of treatment carefully considered and laid out. Joining me now are Crystal Hamilton, a colon cancer survivor, and Dr. Nader Hanna, the medical director at UM St. Joseph Cancer Institute. Thank you both so much for joining us.
You're welcome. Pleasure to be here.
So, Crystal, I actually want to start with you. As I understand it, when you started at the hospital there, you were already at stage 4 with your colon cancer. What were you experiencing at the time?
Well, actually, I hadn't had any symptoms. I actually went for my yearly physical with my, regular physician, and she noticed that I was anemic.
Okay.
So she suggested that I have a colonoscopy, and I had one the year I turned 50, which was like 4 years prior to that, and I didn't have any symptoms, I didn't have any polyps or anything, and I was told to come back in 10 years. But after that, after the meeting I had with her, she said I was anemic, I shouldn't really be losing blood, and I didn't show any signs of losing blood. So she suggested, like I said, to have a colonoscopy. And that determined that I had a mass. I didn't know at the time when I was first diagnosed what stage it was at, but it was just a shock to hear that it was a mass and that it was malignant.
Well, and that had to be shocking because you were doing all the right things, going to your doctor regularly and following up on the colonoscopy and the time range that they said.
Exactly.
So you went to St. Joseph Medical Center.
Yes.
Why did you choose this hospital?
Well, my gastroenterologist is affiliated with St. Joseph's Hospital, and so he set up the team, Dr. Schrader and Dr. Hanna, and it went from there. I originally had partial colon removal maybe 3 weeks after my original diagnosis, and that determined that I may have some cancer in other parts of my stomach. So I started a round of 6 rounds of chemotherapy from January until March. And after that, I had like a month or so in between second surgery, which was more intensive, where I had some organs removed. Plus, I also had the hot chemotherapy, which Dr. Hanna...
I was going to ask you about that. So, and you're doing well now, I see. Wonderful.
Thanks.
Good. It's great to hear. And your team, you work in a multidisciplinary practice. Can you talk about how you work in this practice so that you can tailor treatment specifically for patients like Crystal?
Yes, so we work at the multidisciplinary clinical practice team. It's the team of specialists, includes surgeon, medical oncology, radiation oncology, the gastroenterologist, and a host of other physicians. And our focus is really to treat the whole patient, not just the cancer. So we look at every aspect, from the cancer part to the nutrition to the physical therapy, spiritual aspect of the patient. And we decide what's really the best treatment for that particular patient. So you can imagine if every patient will have to be different. We meet, review all the cases, and then decide what would be the best approach. And this is actually what Crystal had.
And in Crystal's case, there was a specific procedure that you did, and she mentioned it.
Right. So because she had cancer at the time of her original cancer operation, they found that the tumor has spread outside the colon. So this is a condition called carcinomatosis. That's what stage 4. And that's a difficult, actually, to treat because usually chemotherapy is not very effective. So usually there's a combination of extensive surgery, which she had, and at the same time we do intraperitoneal heated chemotherapy. So at the time of the operation, we actually treat her with heated chemotherapy that's more effective and more direct effect on the tumor cells in the peritoneal cavity. And amazingly, she's been doing well, and so great to see her back.
It is wonderful to see you in good health and that you got the proper medical attention that you needed at St. Joseph. If people are watching now, I know that we have the information on the screen and we do have to wrap up, but you have a couple quick tips that if they're watching now that they need to be on alert for.
Right. So the main thing is for screening colonoscopy, it's indicated for average risk person at age 50. For African American, actually the age is 45. The second tip, if you have any evidence of blood in the stool or rectal bleeding, even if you're a young person, it's not hemorrhoids until you have a colonoscopy and make sure it is, because we do see cancer at a young age.
All right. And Crystal, making sure that you're just going on those tips?
Yes, you're at least have a yearly physical to find out if you have anything going on. And just because you don't have any symptoms doesn't mean that there's not anything going on.
Follow the doctor's orders. Thank you both so much for joining us. We'll be right back with more Midday Maryland right after this. Stay tuned.